My name is Ruth Berlin. I'm the Executive Director of MPEN, Maryland Pesticide Education Network. And we're honored to be with everyone this evening because you, our community of concerned citizens, all play a really important role in what we accomplish. We're very grateful for your financial support and your advocacy. Many of you respond to our action alerts. You educate other people in your lives about what you read in our newsletter. And some of you follow us on social media and also share our social media posts and so much more. I'm truly proud of our collaborative accomplishments. And our to-do list keeps growing because pesticides, they're ubiquitous. They are everywhere. So tonight we're really excited to share with you what we've been doing with your support. Uniquely, every one of our board members is somehow actively involved with some aspect of MPEN's work. And tonight they each look forward to sharing with you a bird's eye view of the range of what we work on. And you'll also hear from two members of our contributor community. But we also want to know what concerns you. We will have time for your questions and input if you'd like to share. But before we get going, I'd like to tell you a little bit about how this organization came today. In 1990, my family was living in Los Angeles. I was a fairly happy wife, mom, and psychotherapist until one day that year, we happened to be outdoors in sunny California, a very frequent event, when the state early sprayed a pesticide, malathion, for fruit fly eradication, 3 miles away from where we lived. The pesticide drifted widely, impacting people throughout LA. And it resulted in my suffering from multiple malathion poisoning symptoms. And our then 4-year-old son, Jesse, went into anaphylactic shock. That was scary. Thankfully, he survived. Though after that event, he believed for quite a while that it was actually a bee. The city of LA actually sued the state of California and made them stop the aerial spraying due to so many adverse effects on the state's residents. A few months after my family's LA exposure, we moved to Annapolis, Maryland. For the next few months, basically from July through November, I was extremely ill with pretty much every possible side effect of poisoning from malathion. This pattern from June through October repeated itself for the next 3 years until one day I read in the Capital Gazette newspaper that the state was beginning its annual mosquito control program using malathion. Well, at that moment, my environmental health activist was born. I organized a town meeting to urge the state to stop using this neurotoxic chemical, and I invited the press. Well, to my great amazement, it resulted in extensive media coverage of the issue and the state changing its policy. The state switched from using malathion to what was then considered a somewhat less toxic pesticide. And instead of communities being automatically sprayed unless a community has the wherewithal to opt out of the program, since 1994, communities in Maryland have to opt into the program in order to be sprayed. I fortunately slowly recovered with the end of the use of malathion in Maryland. That same year, 1994, an important year for us, my son's school was sprayed with the pesticide while children were still in the building. And once again, my son Jesse went into anaphylactic shock. He thankfully recovered. And here's a photo of him 15 years ago as a college student. And he's now a healthy, thankfully healthy 35-year-old. But I almost lost him several times to pesticides. The realization that our kids were being exposed to harmful pesticides in our schools led to the launching of this organization. 25 environmental, consumer, and public health organizations came together, including the Maryland PTA and the Maryland Academy of Pediatrics, to address this issue of pesticides in our schools. It took our coalition 4 years, but we successfully passed the very first law in the country requiring schools to protect the health of students and staff by prioritizing non-chemical pest management and to only consider pesticide use as a last resort in our schools. Sadly, to this day, our Maryland Department of Agriculture makes no effort to enforce this law. Be assured we're working on it still. Since then, our work has greatly expanded. But before you hear from our first speaker, let's just take a couple of minutes for any of you who would like to share on our chat what you're most concerned about when it comes to pesticides. Certainly, your concerns are very much in alignment with ours, as you're going to hear this evening from our MPEN board members and supporters, starting with our first presenter, our board vice chair, Cleo Braver.
So you may have heard this before. If you question what just one living being can do, you haven't been in bed with a mosquito. We all have tremendous and really sometimes very unused power. For me, MPEN sees the profound impact that one person can have on our collective well-being. They see the interconnectedness between what you do or your family does on a daily basis, that it affects not only your own health, but the health of our communities, the natural world, and even the planet. How? Well, each one of us can vote with our fork every day, every week, every season for the food system that we want to see. With every meal that we either make or buy, we are actively choosing a food system which either relies heavily on synthetic fertilizers and chemicals, which pollute our rivers, the Chesapeake Bay, our drinking water, and harms the health of our bees, our children, even our soil. Or we can choose to support a food system which nurtures the soil and grows healthy plants and animals, and thus people. And it turns out it can also store carbon in the ground beneath our feet. MPEN shares on our Go Organic website information on lots of health and lifestyle changes that can help you get the synthetics and the chemicals out of your food, your home, your life, and your town. You know, buying local is just simply not enough. Think about it. If you go from eating conventional Florida food to conventional local food, you're still eating pesticide residues, but now you're impacting workers and waterways in your own community, right? But by eating organic foods and eating pasture-raised or grass-raised animals, you'll be supporting the farmers who care enough to grow food in a way that improves nutrition, reduces or eliminates poisons, gives animals a much more natural life, protects our water and our waterways, and even sequesters carbon on the land. On behalf of MPEN, I sit on the state's Healthy Soils Advisory Committee, which is looking into which agricultural practices can help us reverse climate change, with the goal of providing recommendations and financial support to farmers who implement those carbon sequestering practices. Now, as an organic grower and a producer of pastured rather than confined animals, I am definitely a minority voice on this committee. And it's a little bit reluctant to acknowledge that the use of millions of pounds of pesticides and other synthetics really undermines carbon storage in the ground. But I'm a voice for us all, and I plan to keep up the good fight for recognition that organic soil optimally sequesters carbon. But regardless of which practices, either the predominant ones or optimal practices, the public policy chooses to support in Maryland and other states, as a consumer, it's you who's going to make the ultimate decision. You're going to make that decision in your home, in your yard, by implementing organic land care. You're going to make it in your daily food choices. It's really only you who will make the difference. So if you haven't already, check out goorganicmd.org, the website. It also has a library and lots of materials for community advocates to use. With your participation in these daily choices, we can really turn things around. The world's COVID pause has proven that.
Dad?
Well, hey there, son.
We need to have the talk.
You mean
Yes.
like?
Yes.
Are you thinking about?
Yes. The birds and the bees.
Son?
Kids at school were talking about it, so I looked on the internet to find pictures. It was beautiful. Here, take a look, Dad.
Whoa! Wait. Oh.
Dad, bees and other insects, like butterflies, moths, and even bats pollinate 80% of the world's food supply.
Of course.
You do know what pollinate means, right?
Yeah, pollen.
1 out of every 3 bites of food comes from a bee-pollinated plant. And a third of all honeybee colonies in the U.S. have vanished.
Can I have my apple back?
Father, you don't understand, do you? Bees are important. The colonies are dying. Plants will die. Stop using pesticides. Buy organic. Do it now. Sorry, Dad. You see, it's not just the bees. You have to save the birds and the butterflies, too.
Okay.
Okay, we'll finish this talk at dinner.
Hi all. I started keeping bees in 1976. Took me a while to realize they knew exactly what to do. I just needed to stay out of their way. The bees have had 100 million years to figure out what they do, and they do it really well. In the late 80s, beekeepers like me realized something had changed. We met the 4 horsemen of the insect apocalypse, including industrial pesticides. These threaten commercial beekeeping and native insects alike. Ultimately, their use could affect the availability, price, and the quality of our food. And why is that? Because pollinators are needed for 1/3 of the food we eat. Our Central Maryland Beekeepers Association was dealing with a lot of dead outs and failures of hives when we learned about MPEN, the Maryland Pesticide Education Network. We joined the Smart on Pesticide Coalition. Back then, this was a dedicated group of over 70 organizations that had been doing something about pesticide use in Maryland. In 3 years working together, we got the 2016 Pollinator Protection Act passed in the Maryland State Legislature. This bill banned the retail consumer sale of pollinator-harming neonicotinoid pesticides in outdoor consumer products. There was no other law like that in the United States at the time. Since then, our volunteer Pollinator Protection Squad has been checking Maryland stores to see if they were complying with the law. Of interest, we found many were not. The Maryland Department of Agriculture had used a loophole in the law to allow the continued sales of neonics to home consumers. So back to the drawing board. This year in 2021 in the legislative session, we got a bill passed that closed that loophole. Now, clearly, stores can no longer sell such products. Let us know if you would like to join our squad. And by the way, that young activist you saw in the film earlier, that was Ruth's grandson. Great kid, he's going places.
Mom's history exemplifies the consistent concern the public has around pesticides and the growing demand for organic food and products. MPEN and Mom share the same vision of transitioning to an organic lifestyle to protect and restore the environment and mitigate the growing threat that climate change has on our health, ecosystems, and communities. To encourage the people of Maryland to go organic, MPEN created the Go Organic campaign, a website and resource that emboldens consumers to vote with their wallets and vote with their forks and support local organic advocacy, programs, and businesses. Consumer demand is a powerful force driving market changes and ultimately creating a consumer paradigm shift. Just think about how 10 years ago, you could not find any organic food or products anywhere but at a health food store. And now nearly every grocer and retail store has an organic product section. To protect our planet's health and the health of all living beings, the shift to an organic lifestyle is imperative. Organic agriculture is one of the single most significant ways we can reverse climate change, build back soil quality, and reduce pollution from fertilizer and pesticide runoff. The Go Organic campaign connects you, the consumer, to the who, what, where, when, and why, and ultimately cultivates and encourages an organic lifestyle, even on a budget. The website features a Go Organic pledge, advocacy and take action items, news, a blog, buying guides, and encourages consumers to live a more sustainable lifestyle. Please follow the Go Organic campaign on Instagram, and let's all vote with our wallet, vote with our forks, and go organic. Thank you.
Thank you, Allie.
As a pediatrician and medical toxicologist, I have spent decades concerned about the impact of pesticides on our children, especially given that pesticides are everywhere and have had a long history of harming human health, particularly growing children. Maryland Pesticide Education Network's initial concerns back in 1994 was for children, which led to our successful work on passage of the IPM in Schools law Ruth has mentioned. And after that, our advocacy focused on pregnant women and children's exposure in hospitals and facilities for disabled children. But lest you think we are only focused on the youngest, we work hard to educate you and the public about the impacts of pesticides on all ages, and especially in underserved communities. We also provided workshops and booklets for healthcare providers about pesticides and safer alternatives over the last 25 years, so they could all advise their patients about safer alternatives. It's almost mosquito season, folks. 2 decades ago, we started our Standing Water Left Alone Keeps Mosquitoes Close to Home campaign to minimize Marylanders' exposure to endocrine disrupting and neurotoxic pesticides, which were being used by the state for mosquito control. I want to tell you a quick story. In the early 1990s, during the West Nile virus scare, we worked with then Baltimore City Health Commissioner Peter Bylandson, who did not let the Maryland Department of Agriculture spray his city, and instead collaborated with us on educating city residents on how to safely eliminate mosquitoes. It was a great success. So keep this in mind when it comes to your community, whether you wish to opt in or opt out of the state's current mosquito control program. I've been proud of my work with MPEN, testifying on behalf of Maryland Pesticide Education Network for various bills that ended up becoming laws, also providing seminars for doctors and nurses, and co-authoring those journals on peer-reviewed research that we sent to every Maryland healthcare provider. A couple of years ago, we participated in a Friends of the Earth study with 4 families who ate a conventional diet. But for 1 week, they ate organic only. Their initial urine samples showed high levels of pesticides, including Roundup, which is associated with cancer and has been banned in several European countries. Our Baltimore families showed after only 1 week on a strict organic diet that Roundup dropped by 71%. And Roundup was only one of several pesticides we tested for that went significantly down in percent body burden. This type of study has been done by others with very similar results. Sadly, pesticides are everywhere. In our food, our parks, playgrounds, schools, lawns, golf courses. Many are in products. We don't ever despair, as Cleo said so well. We can all vote with our wallets and our forks to keep us and our families healthy. And Maryland Pesticide Education Network doesn't give up. We're working on, through the SOPCN, the different projects you will hear about.
As a physician, having spent over 25 years working in Maryland hospitals, I've been all too aware of how environmental toxins play a significant role in our health. For example, many pesticides are linked to cancer, neurological, developmental, reproductive, and respiratory issues, and more. Alarmingly, a 2006 survey Maryland Pesticide Education Network conducted with Beyond Pesticides found that pesticides used in Maryland healthcare facilities are all too often linked to the very illnesses and challenges our patients are being treated for. In response to this disconcerting news, Maryland Pesticide Education Network launched its Integrated Pest Management in Healthcare Facilities program in 2007 and has worked with 13 facilities and 3 healthcare systems in the state to reduce their pesticide use and implement safer practices with least toxic pesticides that are only used as a last resort. Some of the facilities actually succeeded in going pesticide free. Our star facility has been Springfield State Hospital that has maintained a pesticide-free campus for over a decade. Our current pandemic brought to light another concerning issue. Many of the disinfectants that facilities have been using are pesticide-registered products that can actually be associated with respiratory problems, which exacerbate COVID-19 related respiratory issues. Last March, we got involved and provided facilities data on the hazardous disinfectants and many safer alternatives that can be used instead. We learned these disinfectants were also being used by Marylanders in their homes and in schools, and developed and disseminated fact sheets for the public and school officials. Also, last March, we learned that these disinfectants of concern were likely also used in poultry and seafood processing plants. Farm workers who are already exposed to toxic pesticides that were also being exposed to these harmful disinfectants in their employer-provided housing. This discovery led us to launch Marylanders for Food and Farm Worker Protections, which you will be hearing about in a few minutes. Over the year, we have provided fact sheets for each of these sectors on the hazards of chlorine-based and quaternary ammonium-based disinfectants and the safer choices of alcohol and hydrogen peroxide-based products. And we have made this information available to the public via our social media outlets. Thank you.
Hi, I'm Margie, and I'm a longtime supporter of the Maryland Pesticide Education Network. And I've greatly appreciated the work of the organization over the years, and especially the dedicated work to lobby in Annapolis for reduction in our exposure to poison. I've also attended and appreciated the annual conference on a number of occasions. But this year, I finally rose to the occasion of becoming an MPEN volunteer. So in March, I attended a Zoom meeting of the Smart on Pesticides Coalition. MPEN staff raised concerns about the federal list of disinfectants approved for use against the virus that causes COVID-19. And Bonnie and Ruth were looking for ways to better help people sort out which disinfectants are safer, which are toxic, and best avoided. So we're building a website. It'll be called saferortoxic.org, and schools, hospitals, custodial staff, and individuals will be able to find MPEN's research and guidance on disinfectant choices. So saferortoxic.org is a work in progress. So you're welcome to visit this site, just don't share it on social media quite yet. We'll let you know when it's ready to be widely shared. But I'll give you just one little preview of the content. Definitely avoid the disinfectants that have quaternary ammonium in them, and sometimes those are called quats or QACs. So for now, we can take pride in the fact that our project has reached the point where we just need to sing about it. I bring you the very modern model of a safer disinfectant. Here we go. If you use these products, you might find yourself not feeling fine. Ammonium bicarbonate, glycolic acid, iodine, potassium peroxy, monosulfate, glutaraldehyde, and all the stuff with chlorine, hypochlorite, chlorine dioxide, sodium dichloroisocyanurate dihydrate, can have a lousy, awful, rotten, wretched impact on your fate. And high up on the list of toxic stuff that is best unemployed, quats, QACs, and half the stuff could block your airflow, best avoid. But isopropyl alcohol and ethanol you could have through denaturing the proteins on the surface of SARS-CoV-2. So get your gloves, then clean, then disinfect, and watch the contact time, then sing the song of safer stuff, and don't forget to make it rhyme. Sodium with carbonate peroxyhydrate, twist your tongue and disinfect. Sans side effects, so air will flow into your lung. Peroxide made with hydrogen L-lactic acid. Check the list, check the list. And make sure that the toxic, harmful disinfectants are dismissed. Ingredients with chlorine and the quats aren't puritanical, so better choose the safer disinfectants, not satanical. Ingredients with chlorine and the quats are puritanical, so better choose the thymol that is sourced from a botanical.
Wow. Thank you, Margie. A talented programmer and a talented songstress. Disinfectants from the Pirates of Penzance. I love it. We are so appreciative of Margie's volunteering with MPEN, and she's done an amazing job of taking EPA's disinfectant list to a whole new level. And this will be a first in the nation user-friendly tool for disinfectant buying and understanding the hazards. So we'll send out a notice when we launch saferortoxic.org so you can use it and share it.
Hello, I co-founded the IPM Institute of North America 22 years ago to develop standards for IPM performance and recognition for IPM practitioners. IPM stands for Integrated Pest Management, a sustainable, science-based decision-making process that combines biological, cultural, physical, and chemical tools to identify, manage, and reduce risk from pests and pest management activities in a way that minimizes overall economic, health, and environmental harm. Chemical tools, pesticides, are considered as a last resort when non-chemical approaches are not adequate to achieve the outcome needed. I'm the newest MPEN board member and happy to be part of this group of dedicated, passionate people. It's been a great learning experience and opportunity to contribute. Since MPEN and Beyond Pesticides co-launched the IPM and Healthcare Facilities Project in 2007, I've been the project's IPM consultant, leading facility walkthroughs with facility staff and our project team. Pests carry pathogens that can cause disease. Exposure to mice and cockroaches can cause asthma to develop and trigger asthma attacks, Pests are absolutely unacceptable in healthcare settings. In the project, we focus on identifying and encouraging successes in reducing pest risks and pesticide use. We identify opportunities to improve maintenance and sanitation to prevent pest problems. We focus on why pests are present or might become a problem, rather than treating symptoms of underlying problems with pesticides. We regularly solve longstanding pest problems literally overnight with our proven approach to eliminating the reasons why rodents, flies, cockroaches, ants, or other insects are present in and around a facility. As Gwen mentioned, the project has worked with a number of healthcare facilities and healthcare systems in Maryland, and several have transitioned to a well-managed pesticide-free facility. We just launched an on-demand webinar series for the healthcare industry. This 6-month series covers both pests and land care concerns. In the series, we address how the entire healthcare professional team, including cleaning, maintenance, administrative, and healthcare roles, can contribute to pest and pesticide-free facilities and grounds. The ethos of the medical community is first, do no harm. Our project is all about this and promoting safer alternatives.
Thank you, Tom. And what most people don't know about you is that you are one of the most sought after experts in the country on pest management.
One of the 10 essential public health services is to assess and monitor population health status, factors that influence health and community needs and assets. This information is needed to make science-based decisions and informed decisions to improve and protect the public's health. However, in Maryland, our state government is operating somewhat blind with regards to pesticide use and exposures impacting Maryland residents. Pesticides, which I'm using broadly to cover all insecticides, herbicides, and fungicides, are chemical, physical, and biological agents that are designed to kill. In 2014, a law was passed providing Maryland Department of Agriculture with dedicated annual funds to collect, analyze, and report on pesticide use in the state. This has not happened in a manner that would inform public health decisions, assess ecosystem health, help us understand long-term trends in pesticide use, or inform practices for pest management, despite receiving $130,000 a year in additional funds. Pesticide use data is valuable. For example, in my research on children's cumulative exposures to OP pesticides, I have used data from California's pesticide use database, which is publicly available. This allowed me to estimate the excess health risk to kids from pesticide exposures, adding support to state and national efforts to ban the use of chlorpyrifos. Since 2014, the Maryland Department of Agriculture has conducted only one voluntary survey of a small sample of commercial and private pesticide applicators in Maryland, and the results do not provide needed specificity. The survey provides data aggregated at the county level. It has limited information on location, the target organism, season, frequency, and the crops to which the pesticides were applied. The 2014 survey reported nearly 5 million pounds of pesticides were used in Maryland, and that insecticide use actually increased by 75% since 2011. These estimates were based on data from less than 10% of commercial pesticide users in Maryland, and this likely underestimates usage throughout the state. So if there's no data, there isn't a problem, right? Well, we here at MPEN are continuing to work on righting this wrong.
Hi. Last year, I transitioned from many years of participating in one of MPEN's core programs to become its project director. The successful pesticides in the Chesapeake Bay watershed was co-founded by MPEN and the Johns Hopkins Center for a Livable Future in 2007. It's the first and only such initiative in Maryland that's dedicated to reducing the occurrence and risk of pesticides in the Bay watershed to protect water quality, aquatic life, wildlife, and public health. The project is truly unique in that it's brought together a very diverse stakeholder community, including scientists, public health experts, healthcare providers, beekeepers, waterkeepers, and watermen, federal, state, county, and city government agency representatives, and agricultural community members, as well as environmental and health organizations and policymakers. Now in its 15th year, our annual stakeholder conference focuses on new data on pesticide impacts on the Bay, pollinators, people, and climate change to inform these stakeholders' work and often result in building new collaborative partnerships. Project stakeholders participate in 4 working groups. The research working group is comprised of federal and state agency scientists, and it published a nationally acknowledged white paper in 2009 on pesticide impacts on the Bay. It's currently finalizing a second report to be shared with the Governor's Bay Cabinet, comprised of agency secretaries. Our working groups are also educating Maryland school systems on safer disinfectants, working, as Ruth noted, to ensure the IPM in schools law is finally enforced. We're also updating 2 publications, our popular gardening booklet for the public and our farmer kit on pesticide impacts on farmer families and best management practices they can use. One of the projects we're most proud of is our State House Organic Land Care Project, which was an outgrowth of our working group's meeting with the Governor's Bay Cabinet 11 years ago. In 2012, we collaborated with state agencies and began converting the State House grounds to organic, proving that even this public location can be successfully maintained without pesticides. The State House grounds project has become a model organic land care project, and it's the first state house in the country to go organic. Now, please go to the chat and see if you can answer this question. What bay creature is seriously endangered by neonics that run off into the bay?
This is a curious question that's come up. It's someone who is with us tonight said that they heard that the state had been spraying a mosquito control pesticide that also includes the forever chemical PFAS in it, and is that a concern for the Bay? Can you just briefly address that?
Sure, yeah, it is. In fact, MPEN and the Public Employees for Environmental Protection, PEER, partnered on lab testing Maryland's mosquito control pesticide, Permanone 3030 for PFAS. The lab found high levels of PFAS, which isn't even supposed to be in the product. We alerted the EPA and the Maryland Department of Agriculture, who sprays weekly in 2,100 Maryland communities. Many of them are in the Bay watershed, where direct runoff would be even more exacerbating to the ecosystem. And EPA acted quickly to halt the use of this product that contained 3,500 parts per trillion, when the EPA states one's lifetime exposure should be less than 70 parts per trillion. So while we were successful in stopping the state from using Permanone, EPA is allowing the state to replace the PFAS tested product with 2 similar replacement products that haven't been tested for PFAS. So for all we know, the 2,100 communities and homes that are contracting with private companies and the state may be exposed to a known endocrine disrupting pesticide and the addition of PFAS. And that is a toxic stew, to be sure. So if you live in a community that has opted in for the state's mosquito spray program this year, you can contact your community association, your HOA, or your town and educate them on the danger and have them opt out by contacting the program. And you can also submit a form to MDA to have your own property exempted for 300 feet around your property during the weekly spray program.
Thank you, Bonnie.
I've also really been privileged to coordinate the Smart on Pesticides Coalition, known as SOPC. It's living proof that when people work together, we make a difference. MPEN founded and facilitates SOPC, now 108 amazing member organizations and businesses strong, representing environmental, public health, and interfaith communities, as well as farmers, waterkeepers, beekeepers, bay advocates, and others. Together, we get Maryland laws passed that protect Maryland's babies, bees, and bay from the worst bad actor pesticides. To protect babies, bees, and families, SOPC passed a ban on brain-damaging chlorpyrifos in 2020. We're only the 4th state in the country to outlaw this neurotoxic pesticide. Our bees are dying in massive numbers. So SOPC was the first in the nation to get bee-killing neonics eliminated from consumer products in 2016. And we closed a loophole in the law in 2021. The next year, 2017, we won passage of a bill to set a protective standard for pollinator habitat in the state. We also advocate in local jurisdictions you live in. So far, SOPC has helped adopt safer pesticide policies in Montgomery, Baltimore, Howard counties, Baltimore City, and Annapolis. We try to keep you abreast of breaking pesticide alerts and news, healthier living how-tos, success stories, and solutions through our Facebook, Twitter, and Instagram. We email you alerts to take action and send an awesome monthly newsletter and provide 3 websites. We hope they're doing the job. Let us know in the chat which of these you follow, what you like, want more of, and how we can improve. When you respond to SOPC's action alerts, well, you're the virtual boots on the ground. In reaching your legislators, you're applying that critically needed voter pressure. You all play a critically important role in our success. So these wins are because of your actions. Congratulations.
COVID-19 uncovered longstanding issues of food and farm workers. For 18 years, I worked at Farm Worker Justice, a national advocacy organization in Washington, D.C. I'm all too aware of the social and environmental injustices these workers suffer, the people who we rely on for so much of our food. They often feel like and are treated like second-class citizens and even feel like indentured servants in some situations. And here's why. Most agricultural and meat processing workers lack many of the basic employment benefits that employees in other industries enjoy, including health insurance, paid sick leave, the right to minimum wage and overtime pay, and the right to organize and bargain collectively. In March 2020, the MPEN board became aware that farm workers were not being supplied required equipment to protect them when applying pesticides, as the short supply of N95 masks were prioritized for healthcare workers. It quickly became evident to us that the long-term issues workers were dealing with were now worsened by the pandemic. Lack of protections, no social distancing, fear of job or pay loss if they complain or acknowledge that they're sick. Our Smart on Pesticides Coalition launched Marylanders for Food and Farm Worker Protection, MFFWP, a sub-coalition of 13 organizations to address these issues on the ground and provide education to the workers on their rights, and also to make fundamental changes in basic policies that affect worker health and safety. In the 2021 Maryland General Assembly, Maryland's poultry, seafood, and farm workers gained some important protections with passage of the Maryland Essential Workers Protection Act, which will require Governor Hogan to finally issue an emergency temporary standard to protect all essential workers, including food and farm workers. Though we lost bills on safe worker housing, sick leave, and bereavement pay, we have just started this year, and there is much more for us to do to protect Maryland's food and farm workers. We produced a great 4-minute video on this issue, which we are making available for you to view at the end of today's event.
I joined the board of the Maryland Pesticide Education Network after working closely with them on the Pollinator Protection Act in 2016, which was the first successful legislative ban on neonicotinoid pesticides in the country. That campaign exemplifies the power and significance of MPEN in legislative policy nationally, not just in Maryland. In 3 years, they shaped the conversation among policymakers in Annapolis, from an issue few understood and no one could pronounce, to a chemical that many still couldn't pronounce, but an overwhelming bipartisan majority knew that they needed to ban for the sake of our food, our health, and our environment. And this transformation was possible because of MPEN's successful coalition building and the compelling science-based public education campaign, which ensured that the neonic pesticide ban was the buzz throughout the state. The Pollinator Protection Act became a model for similar legislation in 19 other states, with counterparts from around the country reaching out to learn more about how Maryland was able to do what we did. The Pollinator Protection Act was not MPEN's first success or its last. Through its leadership, Maryland Pesticide Education Network made Maryland the first state in the country to pass an integrated pest management law to address the impacts of pesticide on children as a public health issue. They led the effort to pass a data law that provides the Maryland Department of Agriculture with funding to identify, assess, and report pesticide use in the state for scientists to use. And they have been the chief watchdog to press the agencies to follow both the letter and spirit of this law to create a scientifically viable pesticide use database so researchers can monitor and use the impact of pesticides in our state. Most recently, MPEN led the charge to make Maryland only the 4th state in the country to ban chlorpyrifos, another brain-harming chemical. Looking forward at a comprehensive plan for addressing pesticides statewide, we need your input.
Hi, everyone. I support MPEN because their work supports the whole web of life. And in doing so, care and ministry is given to those living things that have no voice in a time of obvious and significant environmental duress. Every living thing benefits from their work, and that's how it should be. MPEN's deep commitment to their work, their diligence, their extensive knowledge, their uncommon sense in bringing light to issues that powerful people try to obfuscate, to me represents the preeminent model of competence for all nonprofits. So I commend them and I commend their work. Your concerns with the health of our food, the restoration of our soils, clean riparian ways, and the honoring of the fundamental blessing of the gift of good land are things that resonate in all of our hearts. Kudos to the MPEN team and to the wider community of advocates and supporters who share their passion and commitment to change.
Hi, it's been my privilege to work with the Maryland Pesticide Education Network and the Smart on Pesticides Coalition for nearly a decade. As a staff scientist with the National Environmental Group, I worked closely with Ruth Berlin, Honey Raindrop, and the rest of the team to pass legislation banning chlorpyrifos, a dangerous pesticide known to harm pregnant women and children. And our work continues now that I'm a member of the MPEN board. Honestly, I've worked with advocacy organizations on pesticide bills in 7 different states, and MPEN and its partners are consistently the best organized of all the advocates that I encounter. Their talent and their tenacity are second to none. And I think this is why so many national environmental organizations look to MPEN for leadership. And that's leadership both here in the state of Maryland and leadership around the country. The Integrated Pest Management in Schools law that MPEN passed has provided a model for over 30 state and local governments, which have adopted similar policies. And the Maryland Pollinator Protection Act was the first in the country to protect bees and other pollinators from neonicotinoids. Other states are now pursuing bills just like the Pollinator Protection Act. Of course, the chlorpyrifos ban that we passed last year goes further than what other states have adopted, and even what the federal government is now considering. It bans all uses of chlorpyrifos, both on food and in other places like golf courses. And a comprehensive chlorpyrifos ban like that simply would not have passed in Maryland without the leadership of MPEN and its partners in the coalition. So I am proud to support MPEN.
Thank you, Tyler. And I also want to thank all our board members. We hope we've given you some sense this evening of the breadth of what we're working on and how valuable your support has been to our work. And we want to just thank you all for being part of our community. It truly takes a village. And together we are a force to be reckoned with, and we're just gonna continue being just that. So please don't forget the power of you, the power of one. Vote with your fork, vote with your wallet. Keep on signing on for our action alerts and follow us and share our social media posts. Most important, we really want you to stay connected. We really do think it takes and believe that it takes a village. Actually, we know it takes a village.
And I know we have 3 websites. We just want to remind you what the URLs are. And we are getting ready to develop a brand new website for marylandpestnet.org. We have over 700 pages of valuable content on that website, but you might not be able to find it all. So we're going to have a beautiful new website to launch probably in the next 30 days. We'll let you know about that. Our Smart on Pesticide website is also getting a makeover, so it'll make it easier for you to stay on top of the policies and laws that will be changing. And of course, we have the goorganicmaryland.org website, the newest of our 3, and you can look at all the ways you can go organic, even on a budget. We also have very active social media channels. So please friend Maryland Pesticide Education Network on Facebook, because there's tons of pesticide news, and follow us on our 2 Twitter feeds and Instagram. Our newest Instagram venture is at go.organic.now. And lastly, I know you guys have been sitting for a long time, but if you can spare just 4 more minutes, we'd love for you to see our food and farm worker video our Marylanders for Food and Farm Worker Protection Coalition put together to bring to light the terrible conditions of the people who feed us, made all the worse by the pandemic. I know you probably remember seeing headlines that 2 million chickens had to be destroyed on Maryland's Eastern Shore this spring. Well, due to these workers being unprotected and getting sick, the workforce and our food supply was impacted. We'll play the video in a few seconds.
We're learning more about the possibility of airborne transmission of COVID-19 through smaller aerosol droplets infected with the virus SARS-CoV-2, particularly in poorly ventilated indoor environments. More reports support transmission from those who are pre-symptomatic or asymptomatic. This illustrates how easy COVID-19 can spread among agricultural workers, seafood and poultry processing workers, and their communities because of workplace and housing conditions.
I have never seen them so frightened to discuss working conditions. They are terrified because poultry companies are now demanding they sign a non-disclosure agreement when hired. Even so, I'm hearing that some workers who spike a temperature when they report for their shift are given ice cream or Tylenol so they can be allowed in to work. COVID-19 is a spotlight on many ways these workers are poorly treated and considered expendable. They are essential workers, but disposable workers.
Where I live on the Eastern Shore, COVID-19 has infected hundreds of workers in the poultry industry, making us a national coronavirus hotspot. Few of these essential workers have paid sick leave. They can't afford to miss work when they're ill, and many fear losing their jobs if they don't show up, even if they're sick. With only voluntary CDC and OSHA guidelines, our food workers are being told they can either risk infection or possibly even death or not earn an income. The great majority of these low-wage food production jobs are filled by immigrants. They are brown, they are Black. Statistically, this racial group is twice as likely to die from COVID-19. In the coming weeks, many more migrant workers will arrive in Maryland for produce harvests. The conditions they work in and those that they are housed in will put them at risk.
In the absence of federal standards to protect essential food workers from COVID risks, states are stepping up to ensure their communities and food supplies are protected.